Okay, hi everyone. Welcome to session 2 of the conference here. Our first keynote speaker is Dr. Huw Wiltshire from Cardiff. He's an educator, coach, and scientist. He's done a huge amount of work with professional sports teams. He was the director of the Welsh Rugby Union and the Russian Rugby Union. He's very, very knowledgeable. Unfortunately, Dr. Wiltshire can't be with us in person, but he sent a video link for us to watch his presentation. So without further ado, I'll introduce you to Dr. Wiltshire's presentation. Thanks very much.
Good afternoon from the United Kingdom. My name is Huw Wiltshire and I'm based at the Cardiff Metropolitan University Global Academy for Health and Human Performance. From the outset, I'd really like to thank Professor Julian Baker and his colleagues at Hong Kong Baptist University for the very kind invitation to talk at this international symposium. Today, I'm going to explore the effect of Covid-19 on athletic performance and really attempt to answer the question, are we looking at a crisis that has in fact generated an opportunity and a new way of developing performance standards? As of this week, the global impact of the virus has been significant, with 162.1 million confirmed cases of the virus itself and 3.3 million fatalities. This global health crisis has affected every element of society, and this includes elite sport. Undoubtedly, the best prevention is to be well informed about the virus, its etiological factors or causes, and dissemination. The general guidelines for the world have been stay as physically active as possible at home and decrease social interactions. However, during periods of self-isolation, confinement and quarantine, it's been incredibly difficult for elite athletes to undertake critical training regimes, particularly where they need to be involved with teammates and also under the supervision of key coaches and sports science experts. It's very, very clear that appropriate sports nutrition improves both performance, reducing fatigue and limiting the risk of illness and injury. What we also know is it allows athletes to recover far more effectively, and really it is stage 1 of the recovery process. Thomas et al. 2016 also made reference to the need to monitor sleep. And Simpson et al. Talk about sleep as the condition that we cannot do without for optimal performance, as it impacts on both physiological and psychological recovery processes. The postponement of key sporting events such as the Tokyo Summer Olympic Games, the Football Champions League and the Wimbledon Tennis Championships, to name but 3, underlined the growing concerns regarding the scale and impact of this pandemic. The effects of isolation and quarantine on athlete performance has been a focus for scientists and medics globally. In particular, the last 12 months has seen a timeline where we have moved from training that has been individual or group-based, certainly adhering to social distancing guidelines. We've then entered into sort of training camps or bubbles where teams and groups can train. And then this has ultimately underpinned a competition phase where a lot of domestic competition within country has occurred without spectators. In the UK, we've seen cross-border competition with no spectators, but now with the lockdown restrictions being lifted, limited numbers of spectators are being allowed back into competition arenas. This will create issues and problems from a public health perspective and a potential ripple effect into elite sports performance. With regard to an elite sporting context, there is a fundamental tension between the health and economic impact and consequences of the pandemic and the political and commercial desire to actually restart performance and get professional sport back within society. The moral conflict really revolves around the public health strains and the commercial pressure of trying to reignite an economy. Very clearly, there needs to be a requirement for correct decision making, but often this occurs with inadequate or partial information, and it's very difficult to arrive at a measured judgment as to when elite sporting activity can restart. The academic concept of bounded rationality talks about decision makers often making satisfactory as opposed to optimal decisions. And in our current context, optimal decision making has to be the main focus. So how much of an impact have we seen with COVID in relation to professional sport? If we look at the NBA, you can see that all main franchises have had a number of player days in a COVID protocol. The teams that have suffered most are the top ones here: Boston Celtics, Dallas Mavericks and the Toronto Raptors. Lower down we have the New Orleans Pelicans, the Golden State Warriors on the West Coast and the Indiana Pacers. But in essence, this situation has impacted on all athletes. There was some really interesting research undertaken by Figueroa and Bihari, where they looked at a 6-question confidential survey that they administered to over 200 professional NBA players. There were 6 broad categories of key findings. The first finding really emphasised that many players perceived the pandemic as undermining peak performance levels. On a positive, the NBA players felt they actually were managing the psychological pressure quite effectively and had a range of coping mechanisms to deal with the new constraints. This impacted on the third point, which was essentially there was no clear evidence that mental well-being was being negatively affected by the pandemic itself. The NBA players felt that the resource and level of support available from both the franchise and the wider organisation was extremely effective. The major concern for players was the uncertainty regarding specific return to play, because as most professional athletes will tell you, they need a very clear timeline to optimise their preparation. The final consideration was that many NBA players felt they were maintaining basic physiological and performance-related fitness levels, whilst also connecting with the family and friend bubble, and obviously looking at business opportunities during this time as well. So the athlete well-being and the performance lifestyle implications created something of an opportunity. Bisciotti et al. In 2020 highlighted that in fact we have a lot of emergent knowledge coming from this pandemic globally, but the key principle is one of maximal caution, and this has to be applied to any and all research-based recommendations linked to elite performance and COVID-19. Tayech et al. Were pretty clear. COVID-19 does affect physical preparation of athletes as well as their psychological, health and quality of life to an even greater extent. And they really highlighted the key components, which were performance nutrition, sleep patterns, and the need to balance a healthy lifestyle. In a pandemic-free environment, the physiological effects of detraining are well documented, and Mulcahy et al. Talked about 3 main categories. Cardiovascular or respiratory constraints, where we see a clear decrease in VO2 max, stroke volume and hemoglobin content, to name but 3. The musculoskeletal limitations linked to strength, endurance, muscle mass and flexibility. And finally, some broader miscellaneous elements where we see a pattern of rising body fat mass, perhaps a reliance on carbohydrate metabolism, and a decrease in insulin sensitivity. With the onset of a pandemic, it is clear that where an athlete has to actually enter into quarantine or confinement, there is the potential for and a susceptibility to detraining. So in broad terms, there are some very clear practical implications. There will be a negative impact in terms of body mass and composition. There may be impaired efficiency of neuromuscular and cardiovascular systems, and obviously a ripple effect or a regression into strength, speed, flexibility and endurance. Bosque et al. Outlined this very clearly in some quality research in 2013. So if you can now combine the effect of detraining and the symptoms of COVID-19, we've got a situation where perhaps the arousal of post-viral fatigue syndrome can actually start to become more prevalent. What this does is negatively impact the capacity of the athlete to undertake basic exercise and execute effective technical and tactical skills and decisions. In turn, this will actually raise the susceptibility or risk of injury. The work of Bisciotti et al. Highlights that 2 to 4 weeks of detraining will cause a rapid initial drop in VO2 max and then a regression in things like blood volume, hemoglobin content, muscle capillarization, and overall a less efficient body temperature regulation. If this detraining exceeds 4 weeks, you then get a reduction in the arterial venous oxygen difference. Also, a change in the capacity to maximally deliver oxygen. It is also very important to look at the acute responses to the higher intensity and volume of exercise being undertaken by elite athletes, and this can carry with it a far greater risk of illness and impaired immune function. So this has clear implications on the athletes' application of key training principles like overload and obviously their nutritional intake. Graziola et al. Argued that COVID-19 is very clearly detrimental and it impacts specifically on physical performance. Key findings in their research linked to body composition, counter movement jump and sprint performance being negatively impaired after 63 days of quarantine compared with a regular off-season of 24 days, and this occurred in Brazilian professional football players. Very substantial reductions also occurred in physical capability, such as hamstring eccentric strength, ranging from 1 to 11% and 2 to 27% of decreases in absolute and relative strength. Also in relation to cardiorespiratory fitness, which was assessed through a performance test called a yo-yo, and this decrement ranged from 1 to 21% overall. So, in terms of COVID-19 in elite sport, we need to examine closely the effects of this prolonged quarantine and isolation on players' health and performance. Meyer et al. Found that after 5 months lockout in the National Football League in 2011, for example, Achilles tendon ruptures increased by 500%. However, Requena et al. Reported a clear maintenance of jump and sprint performance after a 6-week period of detraining. In contrast, though, there was a very rapid decrement in aerobic performance along with an increased level of body fat mass. The global challenge has been for the elite athlete population to firstly return to training and then return to competition. Iral et al. Described 3 key factors that we need to examine when evaluating an athlete's potential return. Firstly, has the athlete themselves contracted COVID-19, and are there any residual side effects from that situation? The second one is to get a very clear definition on the parameters or duration of the detraining period. And then finally, we need a very accurate picture of the level of physical activity and perhaps regimented training that the athlete has undertaken during a detraining period. So when we talk about returning to performance following inactivity, there are 3 main reasons why lockdown is likely to be more detrimental. Firstly, it does not in any way reflect a traditional off-season period for an athlete, either in terms of the physiological or psychological restrictions of confinement. The other major factor is there will be a knock-on effect. In other words, the following pre-season may well be affected detrimentally because we are looking at possibly a more congested preparation period and as a consequence more susceptibility to soft tissue injury in particular. Where you have a condensed prep phase, the acute or chronic workload demands will certainly be the main factor in making the athlete more susceptible to injury. This was very clear in the work of Bisciotti et al. In 2020. Tayech et al. Talked about the importance of training during home confinement. Although this is often limited to strength, power and muscle endurance activities, there is still a clear window to undertake specific and general physiological preparation. Mon Lopez et al. Talked about the COVID-19 isolation period certainly reducing the duration and intensity of training and also the overall volume and quality of sleep. So again, we have some clear practical implications. A return to training needs to be controlled due to the performance losses or perhaps physiological performance regression. And obviously there is a diminished capability in terms of tactical and cognitive decision-making capacity in athletes. Slimani et al. Were very clear though, basic levels of physical activity and perhaps sport-specific physiological conditioning will certainly improve the rate at which the athlete's quality of life is maintained and may accelerate their return to performance. A key element is absolutely the area of psychological fitness, and in terms of the National Alliance on Mental Illness, they made general recommendations for athletes' self-care during the pandemic. They talked about the need for a structured work environment, and when we talk about structured work environments athletically, we are talking about a prescribed periodized training pattern. The importance of having a normal daily routine is absolutely key. And this is where, again, the sports science and the coaches can have a significant impact on athletes. In terms of activity, it's not just physical activity that needs to be looked at, but also psychological activities or mental skills training. Overall time and energy management needs to be looked at. And this is where strategies such as self-talk, regular communication with others, online and in other formats, nutrition, and structuring daily activity to mirror the normal workday from an athletic perspective is key. Socialisation is vital, and the accessibility to friends, family and colleagues is absolutely critical. Finally, a number of organisations provide mental health guidelines and resources that will help athletes. From a medical perspective, there are very clear guidelines set in terms of identifying indicators of COVID infection and then possible timelines regarding how athletes can best return. The medics certainly provided good general guidelines on a graduated return to play protocol, and these need to be very closely followed. In some ways, it reflects often a rehabilitation program where athletes often struggle or fail with that final return to performance phase where they're trying to rush things to get back into competition. But Elliott et al. Outlined some very clear medical guidelines that would have a strong impact. In terms of overall return to play guidelines, we could monitor some additional factors that would be of value, such as resting heart rate, rate of perceived exertion, sleep, stress, fatigue and muscle soreness, and injury psychological readiness to return to sport. These particular guidelines are extremely effective, from athletes with no signs or symptoms of COVID-19 to some athletes who are hospitalised. And as you can see, this particular flowchart provides a very clear format and a set of references that can be of great value. The maxim prevention is better than cure is absolutely equally critical in our current pandemic. The aim overall has been to lower risk symptoms, prevent transmission and limit numbers affected by this disease. In doing that, we should focus on preventative measures that allow that safe return to athletic performance, minimise the overall number of COVID interruptions, and reduce the adverse physiological effects that may impair an athlete's ability to actually undertake sport-specific training. In terms of what we actually know, it is clear that following a 63-day quarantine, a number of physical performance fitness characteristics will be impaired. And that's because the pandemic does not reflect the nature of a traditional off-season. Specific training and injury prevention programs have to be developed with a careful load monitoring, and with the use of global positioning systems and local positioning systems, this can be achieved very effectively. Decreases in physiological changes, both central and peripheral of the aerobic system, have to be minimised. And finally, Torsdal and Asif suggested that athletes should follow a conservative approach, limiting training sessions to less than 60 minutes and to less than 80% of a maximum ability or capacity during the time of COVID-19. Bisciotti et al. Did some really interesting research in professional football in and around Paris Saint-Germain and Inter Milan. And they talked about a three-phase approach to reintegrating aerobic development. Phase one was around a retraining program, where we look at interval training based on 45 to 90 seconds of running at about 80 to 85% of the maximum aerobic speed or mass. If this is interspersed with running phases performed at an active recovery speed of 50 to 60% of a VO2 max, then we have a reasonably sport-specific, or in this case football-specific intervention. Phase two is geared around an intermittent training approach, and this involves moving from the aerobic metabolism into an aerobic/anaerobic training period. Here we're looking to increase intensity from 100 to 115% of the mass, and then 100% of the mass for training sessions where you work 30 seconds on, 30 seconds off, and then where you look at 10 seconds on, 10 seconds off of very high intensity work, you would raise the intensity to 115% of the mass. But as you can see, it's systematically and progressively increased. Finally, phase three is the sport-specific environment where you look at very high intensity training with a ball. When we examine the deconditioned athlete and return to play, certainly there is a need to improve balance, speed, strength and power. It has been an opportunity in the pandemic to actually get athletes to work on perhaps the weaker aspects of their physical or psychological profile. And in doing so, we can enhance learning, particularly through problem-based learning via online digital platforms. It has been vital that athletes really adhere to individual recovery routines, because this will allow an athlete to supercompensate and get a desired gain from a physiological or performance-related factor. Finally, this environment has been fantastic for actually using social media to disseminate knowledge and positive messaging around key behaviours and values linked to elite sport. So in a global world where digital learning has become more prevalent, it's important to highlight some key factors. In terms of maintaining social networks, as of January 2021, 4.66 billion people were active internet users worldwide. This constitutes almost 60% of the global population. In addition, 92.6% or 4.32 billion also access the internet via mobile devices. Now, these trends in usage have actually increased during COVID-19, and we've got to actually be intelligent in the way we prepare our athletes. So in terms of online decision-making activities, this certainly will improve coach-athlete learning. As we've indicated earlier, nutrition is a vital area, and the consumption of a healthy diet is vital for the maintenance of immune function. It's very, very clear that general advice from Nadia and Hamida said that consuming foods rich in vitamins A, C, E, B6 and B12, also zinc and iron, are vital to achieving this. But perhaps the most interesting research came from Grant et al., where they talked about the use of vitamin D supplementation. And a number of clinical trials have confirmed that vitamin D reduces the risk of acute respiratory tract infections. And there were 30 observational studies undertaken that show incidence, severity, and death from COVID-19 are inversely correlated with serum 25-OHD. Finally, vitamin C, omega-3 fatty acids, will certainly be critical factors in supporting the immune system in those affected by COVID-19. So now we can look at perhaps more focused or targeted supplementation patterns. With regard to take-home messages from this session and perhaps some future research directions, we certainly need more evidence-based strategies for the return to sport for elite athletes. Significant disruption due to COVID-19 carries clear psychological parameters and impacts on an athlete, where perhaps they've had no previous experience of this type of situation. It is critically important to monitor athletes' well-being, because ultimately solutions will be dependent upon an athlete's or a group of athletes' overall self-awareness. Perhaps some key questions can be looked at. Question 2 is particularly important. How can the athlete guarantee a healthy and calorific balanced diet during COVID-19 confinement whilst maintaining and dealing with physical activity restrictions? What are the consequences of COVID-19 induced sleep disorders on an athlete's health? And finally, perhaps the key one, what is the optimal solution to maintaining physiological, physical and psychological parameters in an athlete? I've included some references with this particular presentation, and I would welcome any questions. Very many thanks.
So, if there are any questions, I'd like to try and answer some of those for you if you've got any questions.
No, I'm just asking about the current status of the Olympics. And I was listening to the radio this morning, and I thought of a desperate plea from somebody who was saying, a nurse, who was saying that they're full. And at the same time, the Olympics are asking for 500 nurse volunteers for the Olympics. And so it's a real problem. I don't know how you solve it. There's Olympic athletes all around the world training for 4 and more years probably now. What do you think the IOC and will do?
I think my honest opinion is that they shouldn't go ahead, to be frank, if I was perfectly honest. I realise that that's a very damaging statement to the athletes that's been preparing for so long, as you quite rightly say, but particularly with the new variants that are around now, and the situation does appear to be gaining momentum again. So I think personally it should be cancelled, if I was honest about it.
Cancelled totally or postponed? That was the discussion on the radio.
Well, I think they should cancel it because of postponement, because of the nature of COVID, and we don't know where we're going with this thing yet, really. It may be better to cancel it and rearrange for a future date, 4 years' time, perhaps, you know.
Okay.
Any other questions?
A question, just a comment. I mean, I thought the intervention was really complimenting what you were saying in the first part of yesterday. But what struck me from your intervention yesterday was the moderate nature of exercise, the regular practice. Clearly, the speaker, Huw, was looking at a different type of activity, really looking at athletes. So, with your recommendations yesterday, clearly you were not in the same sample. It's just, I thought they were.
Yeah, I think that when I spoke yesterday, I was targeting the population generally, you know, and talking about moderate exercise as a way of increasing immune function. But of course, elite athletes in particular have got to work at very, very high intensities of exercise. And they may be more susceptible to infection as a result of that. And as we know, when the virus gets into some of these training camps or mixes with elite performers, they get very, very ill and it spreads very, very quickly. So that may be a little, message there of a decreased immune response to the virus itself. But certainly moderate intensity exercise, as we mentioned yesterday, will help boost the immune system, not decrease it, Yes, that's quite interesting one. Force vital capacity may not change actually as a result of the COVID because of the intensity of the test. But aerobic type capacity may change because it's more dependent on lung function. Expired volume test may be too quick to detect any changes from COVID-19. And some asthmatics, funnily enough, get very good FVC volumes. Some don't, but some do, particularly asthmatics who are involved in athletic performances. So an FVC test may not quite be picking up the problem. They need to do a respiratory function test, really, and to determine the effects. Pulmonary fibrosis is one of the outcomes of COVID, which is very, very dangerous. So if there's any issues with that, they need to get it checked out medically, really. The problem with it is, in terms of the sports context, there's very little information really on COVID and sports performance, only what we've highlighted today. And in terms of prognosis and diagnosis and medical outcomes, it's difficult to estimate really in an athletic population, a highly trained population, what the problems are right now. We know it's going to depress responses to physiological performance outcomes as it does in normal populations, but in specific athletic populations it's difficult to define. So there's not too much information in the literature on that right now, unfortunately. The detraining effect is larger, in athletes, obviously, particularly due to the COVID, but also the inactivity, because if you're at a very, very high peak of performance, your isolation or lack of exercise will decline very, very rapidly your performance levels. So in addition to the COVID, the problems with the COVID, the isolation and lack of activity will affect the individual as well. Okay, any other questions? Right, thanks very much.